These are the sort of 12 steps in the development of a study protocol. We'll be talking about them at various points, and I've already talked about some of them. These are to ask a clinically important question, and that's really the key to any study protocol. To conduct a comprehensive literature review. So as I said, that tells the reviewers that you understand what's happened in the past, what's happening currently, and how your study is going to change things in the future. By doing that literature review, you can take your question and refine it so that it is really the most clinically relevant and timely research question. You then, based on that question, you want to decide on the study methodology. So, if it's a prognosis thing, maybe you want to do a prospective cohort study. If you're trying to decide between two treatment options, maybe you're going to do a randomized controlled trial. You're going to determine the eligibility criteria. You're going to choose your outcomes, primary and secondary. You're going to then determine your sample size for the primary outcome. If it's a large study, you're probably going to want to identify your research collaborators and what they're actually going to bring to the table in terms of your protocol or grant. You're going to then write the proposal. So you can see before writing the proposal, there's a lot of work that actually goes into the study. Then you're going to get your ethics approval. You're going to do some preliminary pilot studies to get some data to show that you can do this and you have appropriate feasibility, and then you're going to get your research funding. So tip 5, conduct and present preliminary work and studies. So if you have done work in the area in the past, it's useful to show that that actually exists and shows why that you might be an expert in this area. So you want to discuss any biomechanical laboratory work that you've done. A literature review is good because not only does it help you with your grant, but it also can be an independent study. So conducting and presenting a meta-analysis or systematic review of the relevant literature. And finally, in terms of preliminary work, you can do some surveys. Pilot studies are very helpful. They occur in the form of chart reviews, prospective screening studies, and an actual smaller version of the main trial. You want to, when you're actually including this information in the grant, you want to present data that's relevant to the application, not everything that you've ever done in the area. I think pilot studies are very useful. They are usually about 10% of an anticipated sample. So if you're doing a 2,000 patient trial, you're looking at maybe doing a study of 200 patients, and that basically shows the people looking at the grant that if you can get 200 people into the study in a certain defined timeline, that you'll probably be able to do the pivotal study. So it determines the ability to recruit and screen patients, investigator and patient compliance to the protocol. It allows refinement of surgical technique protocols. So if you're going to be looking at something like total hip replacement, maybe you want to have all the hips done through a posterior approach. It allows you to sort of work through the issues of the surgery if it's a surgical trial. And finally, it allows the reviewers to determine that you're actually able to achieve the appropriate level of follow-up. You want to remember the administrative issues. So there's a lot of paperwork that goes together with these trials. You want to submit complete, accurate, and up-to-date biosketches or CVs in the appropriate format. You want to list all other funding and support held. A lot of granting agencies want to know if you've got funding that overlaps with the current application. You want to make sure you've got administrative help and allow sufficient time for collating the application, getting signatures. So again, this is something that you don't want to leave to the last minute. You want to, again, circulate the application to co-investigators to get their input, and then finally submit the application. Budgets are important. Grant reviewers are usually very experienced, so they're familiar with the costs of research. They're going to scrutinize your budget carefully and look at the costs. And issues associated with that can be critical, because they'll be able to determine whether or not you're overestimating or underestimating the budget. So, if you're underestimating, they'll look at it and say, well, they want all this money, but in actual fact, twice as much as needed. And if we give them what they're asking for, it'll probably just go to waste because they won't be able to complete the study. Similarly, if you're padding the budget, they're not going to look at that too favorably because research funds are limited. So tip 8, get advice and consult with experts and colleagues. You want to have senior colleagues and co-investigators review your grant. Again, it comes back to time, so if you don't do this stuff well in advance, you won't be able to do that. You want to involve other experts, so medical and surgical specialists, biostatisticians, clinical trialists, health economists, and administrators. You want to know the criteria for the grant review. So different agencies may have different factors that they look at in terms of the grant. And so just sort of sorting that out in advance can be very helpful. And certainly talking to senior colleagues that have experience in this area, they'll often give you some insight in terms of what a specific granting agency may look for, because they may be reviewers for those granting agencies. Tip 10, don't get discouraged. I think the thing is that most grants aren't usually successful on the first crack. So if you're rejected, you don't want to be discouraged. Multiple submissions are common. You want to revise your application and make it better so that ultimately it will get funded. You want to read the reviewer's comments carefully and multiple times. You want to respond to their concerns on submission. They like to know that their comments are being considered. And if you can go away, deal with the issues, then often on the second or third submission, you'll get the funding. You want to highlight positive comments. You want to use a polite and positive tone. You don't want to get into an argument with reviewers, and you want to put your ego aside. They're trying to make the study better, and you want to take those comments constructively. And finally, you want to avoid common errors and weaknesses. So submitting to an inappropriate funding agency, if it's an agency that focuses on clinical research, then probably not the best to be putting a biomechanics study, and vice versa. Lack of knowledge of the published work on the topic is important. So again, understanding the literature and where we've been in the area is important. A lack of new or original ideas. So again, having an important research question, an unfocused or vague research plan, so you want to make sure that that's good. Lack of appropriate expertise on the study team, again, that gets to the whole issue of feasibility. Presenting insufficient details about the study methods. Failure to have co-investigators review the final application. That's critical too, because they can have a lot of very significant input. Failure to proofread and add in the finishing touches. And finally, planning to do an unrealistic amount of work. So again, that gets to the whole issue of feasibility. So, in conclusion, successful applications are clearly written and concise. They're not beyond the capabilities of the investigator, so the whole issue of feasibility is absolutely critical. It addresses an important and controversial clinical problem, so again, spending a lot of time on the research question is important. You want to be innovative and show that you have something that's feasible. The conduct of a well-conducted study requires a large time commitment, so you can't just decide you're going to do a randomized trial and then submit something 2 days later. Usually, if you're doing like a 1 or 2 year trial, you're looking at having at least a year of planning. You want to follow all the steps for success, and attention and detail to the study plan are going to limit problems during the conduct of the study. Thanks very much.